Hello everyone, this is a COVID-19 quiz intended for all healthcare professionals managing COVID patients. There is a response time of 15 seconds for each question. If you need more time, feel free to pause the video. A 32-year-old male of moderate COVID-19 with chest imaging revealing bilateral lung infiltrates typical of COVID pneumonia and procalcitonin value of 0.15 nanogram per ml. Which of the following is appropriate choice about antibiotic? Here are your options. This is the answer. Tocilizumab is a recombinant humanized anti-IL-6 receptor monoclonal antibody. The contraindication of its use in COVID-19 includes all except. Here are your options. Here is the answer. Based on earlier study which showed outcome benefit for steroids in the treatment of severe and critical COVID-19, which of the following steroid was studied? Here are your options. Here is the answer. Which of the following treatment has shown benefit in COVID-19? Here are your options. Here is the answer. Individuals of all ages are at a risk for infection and severe disease. However, the probability of serious COVID-19 disease is higher in all except. Here are your options. Here is your answer. All the following statements are true about mutation in SARS coronavirus 2 except. Here are your options. Here is the answer. An adult of COVID-19 with acute hypoxemic respiratory failure, despite conventional oxygen therapy. What will be your next action? Here are the options. So here is your answer. True or false? Awake-prone positioning should be done as a rescue therapy for refractory hypoxemia to avoid intubation in patients who otherwise meet the indications for intubation and mechanical ventilation. So here is your answer. Remdesivir, an antiviral agent, is currently the only drug that is approved by the Food and Drug Administration for the treatment of COVID-19. It is recommended for the use in. Here are your options. This is the answer. Dexamethasone, a corticosteroid, has been found to improve survival in hospitalized adults with COVID-19. Which of the given category should not receive dexamethasone? Here are your options. So here is the answer. Which of the following best describes about treatment of adult COVID patient? Here are your options. So here is your answer. If a hospitalized patient is positive for both influenza and COVID-19, which of the following statement is not appropriate about this? Here are your options. Here is the answer. Based on limited information available till date regarding infections and use of antibiotics in COVID-19, which of the following statements is false? Here are the statements. So here is the answer. Which of the following best describes coagulopathy and anticoagulation in COVID-19? Here are your options. Here is the answer. Which of the following is not true regarding COVID-19 testing? Here are your options. Here is the answer. Which of the following is true about route of transmission in COVID-19? Here are your options. Here is the answer. Which of the following statement about CT diagnosis of COVID is true? Here are your options. And here is your answer. Based on recently published study regarding plasma therapy, it has shown to be beneficial. Which patient category has shown benefit? Here are your options. Here is the answer. It has been seen that tocilizumab is effective in COVID-19. All the following statements are true except. Here is your options. Here is your answer. CT scan chest in COVID-19. All the following are true except. Here are your options. Here is the answer. Which of the following statement is most appropriate about COVID-19 vaccination? Here are your options. This is the answer. A 45-year-old male is admitted in intensive care unit on oxygen therapy through high-flow nasal cannula. He is positive for COVID-19. Which of the following terminology best describes him? Here are your options. Here is the answer. Which of the following treatment is appropriate for a patient who is not hospitalized, has mild to moderate disease, and on a high risk of disease progression? Here are your options. Here is the answer. Based on available evidences, which of the following is true about use of ivermectin? Here are your options. Here is your answer. Which of the following statement is true about severity of COVID-19? Here are your options. Here is the answer. Regarding target oxygen saturation in COVID-19, which of the following statement is most correct? Here are your options. Here is the answer. Thanks for watching this video. Write any feedback that you have in the comment section down below.